Thank you, City Council, for having me here today to speak. I'm a Black woman with vision loss. I'm here representing the sight loss community as well as the GTA Disability Coalition.
Good morning, member. Thank you for the opportunity. My name is Keya Osborne, and the GTA Disability. I am here to urge
council to invest meaningfully in accessible health care for Torontonians living with sight loss, especially those living with compounded barriers, especially with disabilities, race, income, age, or language. Across Canada, estimated 7.4% of people ages 15 and over have a sight disability. That's nearly 2.2 million Canadians who are blind, partial sight, or deafblind. Many require specialized care and supports to participate fully in everyday life. Locally, more than 570,000 Toronto residents live with a disability, and this number continues to grow as our population ages. For these residents, accessing health care is not seamless, and these barriers include inaccessible appointment booking systems and health information, clinics and hospitals difficult to navigate, inadequate wayfinding, medical forms results are not in accessible formats. And that, for example, not really available in digital formats for screen readers like myself. Frontline staff which have limited knowledge and training on accommodating persons with disabilities as well as persons with sight loss. These barriers are not minor. They contribute to delayed diagnosis, poor health outcomes, emergency room use, and avoidable health inequities. Accessible health care is about equity, dignity, and the basic right to receive care safely and independently. The City of Toronto's 2026 budget sets a tax-supported budget of $18.9 billion and a $63.1 billion capital plan over 10 years, focused on affordability, mobility, and services that Torontonians rely on. This is a powerful opportunity to embed accessibility into core services and infrastructure. While municipal government matters, even though healthcare delivery is a provincial responsibility, the city shapes whether people can access care through transportation services like Wheel-Trans, which have 4.4 million projected rides in 2026, demonstrating the demand and reliance on accessible transit to get to healthcare appointments. For health appointments, public health programming within the city's budget that touches preventative care and community supports. Municipal leadership can make a difference between preventative care and crisis care. Accessible systems reduce emergency costs, strengthen independence, and reduce health inequities. Investments here are both a human rights imperative under the AODA and the Ontario Human Rights Code, and the cost-effective public policy choice. So here's some key recommendations for this funding cycle. 1. Invest in accessible health infrastructure. And again, I mentioned wayfinding, accessible materials, so that persons with sight loss who are blind, deafblind can have readily access.
Fund disability and sight loss training.
So funding sight loss training.
Page 3. 2.
Number 2, expand accessible health information and communication. Ensure appointment reminders, results, and consent forms are all again in digital formats.
Education with 3.
And number 3, fund community-led disability-informed health programs. A dedicated funding stream for disability-led organizations will support preventative health education, mental health, and system navigation programs, especially those for racialized, Indigenous, and low-income communities that face compounded barriers. In closing, accessible and equitable healthcare is not a luxury, it is a necessity. When Torontonians with sight loss cannot access healthcare, this ripples across the health system in our community. With the 2026 budget process underway, this council can show leadership by ensuring that accessibility, dignity, and independence are priorities and in investments. Thank you for listening.